Let's get into the substance a little more. I mean, talking about the pre-existing conditions as one very important point in the bill. How does that affect people? If some version of this or something close to it passed the Senate and actually became law, what would it mean for people who have pre-existing conditions, both people who get insurance now through employers, the way I do, the way I suspect you do, and people who are in some part of the public system, whether on Medicaid or buying insurance through the exchanges?
Yeah, so it's incredibly complex the way that they're going to that it happens. So under the bill, a state could opt out of the pre-existing protection rules. And they do by telling the federal government that they have an alternative plan that's going to make sure that people are covered for it or that premiums will go down. Those are very low bars to meet because it didn't. And so basically, if a state requests to be relieved of the requirements for pre-existing condition protections for people or maintaining minimum benefit standards like having to cover maternity and mental health, they could opt out of it. So why would a state then propose that they want to remove those protections? And that has to do with the rest of the bill. So the rest of the bill, the one that was withdrawn a month ago, replaced the individual mandate that you had to buy insurance with the idea that you'd get a penalty of a 30% premium surcharge if you had a 2-month gap in your insurance coverage. So in a sense, you pay more for insurance if you don't have insurance. The result of that is that healthy people will be the ones who won't buy insurance. And then when you really need it, you will go and try to find insurance. And that will lead the people in the exchanges in the private market to be sicker and sicker population. So the states, in order to keep the premiums under control, at some point will start to try to, will feel a ton of pressure to then loosen all of the insurance standards because you're not getting enough healthy people to sign up. And that's when minimum benefit standards and protections for people who have healthcare issues would be the kinds of things they'll feel the pressure to look for a waiver from. So that's where people, a friend of mine who has just been diagnosed with cancer and like most of the new jobs out there is working in a freelance capacity. She's deathly afraid that this could go away.
Yeah, well, I mean, but under Obamacare, you were supposed to be penalized because of the individual mandate if you didn't buy insurance. But then if you were diagnosed with cancer, you could still enter the exchange and get insurance. They couldn't discriminate against you. Now, if that happens, what would happen to the same person? I mean, the game of not buying insurance until you get sick doesn't work anymore under this system theoretically, because they can discriminate against your pre-existing condition, and you can't assume that you'll get insurance that will cover your condition if you wait till you get sick.
That's right. Under the bill, before they made these last-minute amendments, they'd said, look, you're still assured that you have pre-existing condition protection. So if you didn't buy insurance, you'd have to pay a 30% surcharge when you signed up if you were waiting until you got sick. And then the other thing they did is they heavily cut the subsidies. So the charges could be, the amount that you're having to lay out could be quite high. And the reason why they said that 24 million people will lose insurance is because the costs would turn out to be so substantially high that it's almost like it's like a penalty on the sick for getting coverage. Now you add in this formal also opportunity that the state can opt out of these pre-existing condition protections. Now, if I unexpectedly get diagnosed with a cancer, didn't have insurance, I try to go sign up, they can charge me any amount more or just exclude you automatically from coverage. So 27% of the American population under 65 has a healthcare condition that automatically excluded them from insurance coverage before Obamacare. So all of those people would be back into a world where private insurance wouldn't necessarily even be offered again if a state requested their way out of this. Add in one more thing. If one state decides to ask for the pre-existing condition waiver, and you're in a large business, that business now can offer insurance can follow the rules of that one state. Under the bill, they made it so anybody who has employer insurance also could get out of the minimum benefit standard. So they could drop maternity health, they could drop mental health coverage and things like that. So a lot of people could potentially find themselves in that position. What they offer as a backup is these high-risk pools.
Explain how that works a little more, Till. So this backdoor, because what you're saying is that in any state, the state that has the most effective lobbyists and the legislators with the least integrity, if they can get any state out of 50 to let them off the hook on the pre-existing conditions, it then applies in 50 states? How would that be?
If you get and it's especially around the minimum benefit standards that they opted you out of that. So if that state with decides to opt for dropping minimum benefit standards, and those are requirements that you have to cover maternity care and mental health and preventive care. If one state opts out of it and you're a large employer, they included an amendment in the law that would allow that employer to use the standards of that lowest common denominator state.
And what about a state like yours that had its own universal coverage?
Yeah. And so on the one hand, we have both the Republican and the Democratic Party here vowing that if it disappears on a national level, they will sustain it here. But in order to sustain that here, they would need still the authority federally from Medicaid to use their Medicaid dollars to cover people more broadly and to maintain kind of these kinds of benefit standards. And the provisions in the Act that start loosening those protections means that there are ways in which large employers could decide to not follow the Massachusetts rules, even though they're employing you here.
So what do you think the world would look like for doctors treating patients? I mean, doctors like yourself, not in Massachusetts, but in a state more like a southern state or a western state that isn't likely to maintain its own robust protections.
Well, so it partly depends on what state you're in, because you had about a third of the states that were conservative, mostly southern states, that did not take the Medicaid funding to expand Medicaid. The result, though, is that if I'm a doctor practicing, let's take a few example states. If I'm a doctor practicing in Ohio, John Kasich opted the state into Medicaid. So they got Medicaid coverage that covers everybody who is poor or near poor and ensures them that they have coverage. And they can and if you're above that income level, you can get coverage on the healthcare exchange. So that's a state. Also, Kentucky's another like this, where they dropped from 16% uninsured to just 7%. And basically, if you got sick, you would get you had access to being signed up for coverage that would assure you that you would get coverage.
There's no gap. I mean, if you're really poor, you get Medicaid. If you're poor but not desperately poor, you get the subsidy. And in any case, you can buy insurance through the exchange. That's
right. And what people complain about is that the average person who is on the exchange has a $2,500 deductible. And when I talk to my friends back home in Ohio, where I'm from, their big complaint is that I don't have $500 in the bank and I've got a $2,500 deductible. So, one friend had a heart attack and he was covered from a devastating $30,000 expense and, had his life saved and wasn't bankrupted by it. But still, other folks can have a hard time coming up with that $2,500. The bottom line, though, is if I'm a doctor and think about people I've seen, I'm a cancer surgeon, right? I have not taken care of an uninsured cancer patient in years. And for people in places like Ohio who practice in those kinds of fields, they're seeing and experiencing the same thing. It's a dramatic transformation. I used to take care of about 15% of my patients were uninsured, and we had to figure out how are they going to get their chemotherapy follow-up taken care of, how are they going to get their radiation paid for, and things like that. That is what has disappeared. Now, a place like Mississippi didn't take the Medicaid funding. They've actually had an increased number in uninsured. They're over 20% uninsured, and things are clearly not going to get better there. And the people who are on the exchanges, that's about 7% of the American public are on the exchanges. They're going to increasingly drop out. So you'll only see those numbers rise.
Overall, does it just look like the world we had before Obamacare?
Yes, and in some cases potentially worse. That's for two reasons. Number one is that the number of people who have pre-existing conditions is rising, and that's for complicated reasons. 27% of the population, I said, under the age of 65 have a healthcare condition currently that made them uninsurable before Obamacare. So that's a substantial number of people, and the world has changed in two ways. Number one is over 90% of the new job growth has been in non-traditional categories. They are jobs without salaries and benefits. You're freelance workers, temporary workers, contract workers, and those people, you have a larger and larger number of people fall in that category who have to get coverage out on their own. And so you have many more people who are unprotected than were unprotected previous to Obamacare. That world has changed. The second thing is big data. The fact that we have big data now means that the insurers can look at everything from your shopping patterns to your zip code to other kinds of factors that are beyond just what your current healthcare issue is and predict people who are likely to be at high cost. AI is making it so that larger and larger numbers of us, eventually all of us, you are able to predict how much healthcare needs you'll have in the future, and for larger chunks of people, you are someone even before you have a health issue. You become someone that insurers would love to avoid signing you up or would charge you a heck of a lot more. So, the world has changed in ways in which we're all pre-existing conditions waiting to happen and going on to job markets that are less and less likely to have healthcare benefits of any kind, let alone decent healthcare benefits.